Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Okay, we're going to go right then on into the discussion about active, do-at-home self-care techniques. I'm going to pass this out, take one. Some of you already have these. It's okay to take another one. So as we discuss, you can review. The reason I do this class is because very often one of two things happen, or sometimes both. The person doing the active care at home, like the sexual slide, are not doing it correctly. A lady the other day, she said, "Oh yeah, I'm doing it." I said, "Show me how you're doing it." She went real fast.
Yeah.
And that you don't do it that way. So today we're going to kind of review, and I'm going to fine tune, because the more accurately you do it, the better it is for you. I want to mention one more thing before we start going over the paper. When I was in chiropractic school, they had every year homecoming. At homecoming, doctors would bring case studies. That's where you brag. So they would say, they go over the case history, and then they tell you what they do, and you probably attended some of those at Palmer. And a couple things that always showed up. One, what's called upper cervical techniques. The doctors who only adjusted the top would get good results with all things in the body. That was taught at my school. Logan College in St. Louis taught to do everything from the bottom up, from the sacrum. They always had the best correction of curvature, so like pre and post x-rays. There were a few other techniques, but the biggest, most successful techniques involved the neck, the head, upper cervical, the sacrum, and the pelvis. One technique, the only thing the doctor did was take a stand-up x-ray, look at the holes in the height of these holes, lay you on the table and whack you, and create motion. And then they would trust the body to the doctor within to fix the problem. Now, I learned all of those techniques. I went to the different colleges, and what I'm teaching you in this class is a summary of multiple techniques. A lot of chiropractors are what I call technicians. They just, I know this is recorded, but they rack and crack, they pop and pray. My first introduction to chiropractic was with my dad's cousin, who practiced in West Jordan, Utah. Bruce Egbert was his name. And my parents would take me down there to see him. My thoughts as a teenager were, if I live through the adjustment, it probably will help me, because he had no mercy. He would lay me on my side and give me the old lumbar roll both ways. Then I would lay on my back, he'd grab a hold of my head to me it was like wrestling the steer when we trying to take him down to castrate me. He'd grab a hold of my head and turn and whack and then he'd say, okay, you're done. I think, oh, good.
Oh,
Good. But see, what he did technically was created motion in the low back and in the neck and head. And then the body then would make self-adjustment. So what we're doing is the same kind of thing, but totally different mentality. The mentality then was just move it. My mentality is we're going to help the body move it a teeny bit and grow new tissue that will hold it in place. That's actually the bad news, because it takes quite a while to get correction. But when you get it, you're usually very stable. And you can do it all at home on your own. Go ahead. Now, I'm going to hand out to you an ideal neutral posture. When I say to you, we're trying to help the body get back to ideal neutral posture. That is the divine design of the body. The body is designed to function and to be aligned properly. So as we go through these, I'm going to make some comments about some of the ways to look at the body alignment. When we talk about the head, the hard palate should be horizontal. And anytime you get the hard palate too high or too low, you've added expense to the body to maintain an abnormal posture. If you're reading at a computer, you look cleaning the ceiling or painting up there, it costs you more energy. So if you think like an accountant, you're spending energy. And most people at your age live on a fine line relative to energy. Most of you are running a deficit. And you know the way we test that. We test by doing the Ragland's test. You really don't need that, but you know when you're tired. But in our society, we don't stop, we don't rest when we're tired. We do what?
Keep going.
We keep going.
We've got to get it done.
We've got to get her done.
I think if you do that enough, consistently, you lose your ability to know when you're really tired.
Thank you for saying that, and that's exactly right. And so when I ask some people, "Are you tired?" And, well, not you, not really. Kind of, well, they kind of hum and haw, about like always. And then I ask, when you sit down for a little bit, do you fall asleep? I saw your friend the other day, and his wife said, every time he sits down for more than 5 minutes, he falls asleep. Do you nap? Oh no, I'm too busy to nap. Did he fall? But his body wants him to go to sleep. So hard palate should be level.
What's the hard palate? How do we know?
Roof of your mouth.
The roof of your mouth.
Okay.
Okay.
How do you know if it's horizontal?
In my office, I have a yoda on the floor that has a bowling ball in it and have a spoon in his mouth. The spoon in his mouth if you put a spoon in your mouth on your hard palate, and you put an egg in the spoon, you will.
It has to be level.
Level.
You keep it level.
Okay.
And
You
then
can try it
if
with
you-
water if you don't want to break an egg.
avoid tilting
thank
this.
you.
Avoid tilting to the side. Both sides. Now it's okay to tilt. We can all tilt, but if you stay there, you get in trouble. A lot of people curl up on the couch and watch TV. You know, and they end up in trouble. Neck should have a nice forward curve. So when you lay down on or sit, you want the neck relaxed. By design, that's the shape of the neck. If you sit in a chair that has a high pull and pushes you forward, you're laying in your bed and you have a pillow under your head, 1 or 2, or sometimes people go 3. You'll never be optimally healthy. You want to have the head in line with the back of the back and the neck supported with a small neck roll. Neck, flat forward posture. Shoulders, you talked about that earlier. Scapula back. Now you can tell if the scapula is spread, if the scapula in the back is spread, the arms will turn this way. You'll see people stand with the knuckles forward, like the monkeys at the zoo. They walk around like this. You want to be thumbs forward. When you walk, you want to walk with the thumbs forward. When you shop, you don't shop like this, shop like this, like you said, palms up and get in close to the cart. If you do that and walk slow, take smaller steps, technically you're getting therapy while you shop.
That's an excuse to shop more.
Yeah.
So if I go shopping with myself or Audrey, I always get a card. She said, we're only going to buy one thing. I'm doing therapy. So I'll catch you.
So you hold the cart like this?
Yes. That will bring your shoulders back, bring you up straight. Mid back, avoid slumping, slouching. Low back has a design again for the curve. Now, I'm going to jump around a little bit. When you do the sacral slide, you land on your back, your feet are aimed straight up. You slide your hip away, right hip first. You breathe in, slow, 5 seconds. Pause. 5 seconds out. The deeper you breathe, the more valuable the therapy. When your feet are straight up, you're doing more therapy for your low back. So when you think of your rod, when you do that motion, you're aligning the low back vertebra. You're helping to mobilize equally the sacroiliac joints, the big joints. And one of the techniques I learned, the only thing I taught was how to move that sucker. Okay, it was not nice. It was you whack it hard to create mobilization. The bad news is it never stays where you put it. It always go back. So the idea with our therapy is move it slow and retrain it.
Twice a day?
Twice a day is great. Now, back to the sacral slide. When you turn your feet out, you're done with this one. You pause, turn both feet out, breathe deep, slide, pause. 5 seconds both ways. You're doing more therapy here, upper lumbar, lower thoracic. Now, That's the area where most people who have digestive problems have misalignments. The nerves that come out of that region go to the gut. Now, truthfully, all the positions do all of the tissue, but mostly the ones I'm telling you about. Now, when you do toes in and breathe, you're doing mostly upper ribs, lower neck, upper spine, lower neck and head. If you have a neck roll, you're doing a lot for the neck. Did that make sense? Now that's half of the sacral slide. You do the right leg, you breathe in. Now when you do the left leg, when you do the second half, you lead with the left foot. Always. Right foot first, left foot second. Now think about this. The first time you did it, when you breathe in, the right leg went down. Sometimes, one of the techniques we learned is, sometimes people would have, like the SOT technique, they would say, oh, you're fixed or stuck only in inspiration, or only when you exhale. You're good part of the time, so you're going off, on, off, on, off, on. So when you do the second half of the sacral slide, you're breathing in with the left foot first. Okay? That's different. That has a different effect on your head, and has a different effect on your spine and pelvis. It's important to do that. Now, if we time that, 5 seconds in, 5 seconds out, we do 3 of them, then we do 3 more. It took about a minute, to do the sacral slide. And you adjusted the whole spine.
I have a question. When I do the toes inward, I get more strain on my left side. I don't know if it's because of the way I'm built or twisted or whatever, but
Let me comment on that.
okay.
Your goal is to be symmetrical. So if you find that you're off, if they're different. I told you about the concept of team of horses. We have a small horse, we have a big horse. The big horse has to be smart enough to not overpower the small horse. So back to your one leg goes further or turns out or moves better than another. Always try to do the best you can to match the restricted one.
But it's the low back that gets pulled when I do the toes in instead of the upper spine.
No,
I mean, that's where the discomfort is, or the stretch.
okay. If you have a pain when you do it, and the pain is greater than a 5, you've exceeded tissue tolerance.
It's not really pain, it's kind of a owie, but not really.
Then keep doing it.
Okay, but why would it be in the low back if it's supposed to do the upper spine?
Because like I said, each position does all of them.
Okay.
I've got a question about that. So you just mentioned to not exceed on one side what your restricted side can do.
Exactly.
So if my left side doesn't, like my right side, I can go way out, but my left side for some reason doesn't, like it's like I have less leg or something. It's weird.
Match them. Remember, we're trying to train the new tissue to be symmetrical.
And it's about balance, right? So
Well-
if one side is restricted or more painful, and you're not going very far on this side, and the other side you're going way far, which it's not really that far, but it feels like it. You're creating more imbalance.
Exactly.
If you go the same on both sides, you're creating balance.
Now keep in mind, we're not just, let me back up. The tissue that we're involved in the rehabilitation process is nerve tissue, muscle tissue, arteries, veins, lymphatic joints. Joints always involve tendons that are on the end of the muscle and ligaments. The ligaments hold the bones together. Now, with your pattern, you have a lot of damage in all of those tissues. So we want to back off and do just enough to help enhance rehabilitation to normal balance, motion, balance, and then alignment. Alignment always comes last. Okay?
So, I know someone really well who has fused neck and fused lower back. Is gonna do him any good to?
Those are the people who need to do this more than anybody. Why?
His idea is that nothing's gonna move because it's fused.
That's not true. Let me comment on that. That's a perfect question. And we talked about it after we stopped the recording last week. I had a patient, his name was Randy. Randy at birth had congenital fusion in this part of his back, about 7 vertebrae. When he was about 15, 16, the surgeon decided they would fuse 2 more above and 2 more below. And they told him, you will not live to be more than 21. Your body is totally, it was very distorted. He had normal legs, his pelvis was pretty good, but his spine was fused and his head was way over here like this. So when they came to see me, again, he's fused by birth, by surgeons, but his head was not balanced over the pelvis. The head needs to be balanced over the pelvis, not leaning left or right. So I said to Randy, we need to prop you up temporarily and retrain your body to be balanced. So your friend who's had surgery here and in the neck, the big thing for them is to reestablish balance, even if it needs to be done artificially. For example, with Randy, we put a lift in his shoe to raise up his hip about that much. He didn't like it, but what happened is, with that in, his head moved over toward center. And as his head became more comfortable being balanced, we took the left out gradually, and so he ended up balanced. He had a curve and he had a fixation. We could never take that out, but we had balance, and so he started to function better. Okay? I treated Randy for over 10 years. Randy kept getting more healthy. Randy then moved to California, got married, and had a couple of kids. And he came back to visit me in Colorado. I said, Randy, how are you doing? He said, oh, I'm doing great. I'm skydiving, I'm golfing, I'm surfing. I said, Randy, you remember, you have a fusion. He said, oh, I know, but I'm good. And so, life goes on. But so I
And he's older than 21. He didn't die at 21.
No, he's still alive at 34, or that's I've heard from him. Anyway, I've treated people who have rods full length with curvature. They've been in car accidents. They all respond to the basic concept of balance and better motion.
So balance comes before motion and then alignment? So balance.
They
motion,
come to get balance and motion come together.
Okay.
Now that brings up another point that I wanted to mention today. If you feel tightness on either side of your back. And you will feel tightness on the back of your head and the upper back in your neck if you spend time with your head forward. I told you before, the head weighs about 10 pounds. If you go forward 2 inches, now it has the effect of 20 pounds. Just tipping your head. Now we're talking like the laws of physics. If the head goes forward another inch, it doubles again. So if you sit with your head down, you're holding up 40 pounds. Now if I gave you a 40-pound weight and said carry that around today, all day, you'd tell me after about 10 minutes, I'm done. I'm not doing that. But people do it. So they end up not having energy left to fix other things. Okay, think of this elastic. If that elastic is tight, think of that as a tight muscle. What does the muscle want? More tight, more pull?
No, relax.
It wants to be
Shorten. Shorten.
shorter. So if you have a tight muscle anywhere, do you stretch it out or do you relax, shorten it? Shorten. If you have a T-zone, all you have to do is, if it's tightness is back here, just lean back a teeny bit, not back here, just a teeny bit, and let the machine shorten. Now next week I'm going to talk about the T-zone a lot. By the way, this is a commercial, time out, commercial time. My wife is turning 76.
Wow.
What?
Youngster.
Wow, yeah, on the 14th. She thinks everybody should have a T-zone. I said, okay, I'll have a sale. So between the 5th and the 14th, T-zones are going to be on a super special sale, lower cost than they've ever been. If you haven't got one or you have a friend that wants to buy one, now's the time. And the price is so good, I'm not going to publish it. If you want one, talk to me personally.
When did you say the dates were?
5 to 14. 5 to 14 in that time range. So
September
that goes for the big one and the little one both. So the only thing I'll tell you about the price is the last two numbers are 76. Okay, we need to move on. So we talked about the sacral slide. I've reviewed with you how to do it correctly. Anybody can do the sacral slide. Now let's talk about the next most important active self-care therapy, and that is on your sheet, the occipital release. Do I have the right? Do you have it?
Yeah, it's in the middle.
You got it?
Yeah.
Okay. So let's talk about the occiput. The occiput is the blue bone. The brain and the spinal cord stick down through that hole in the bottom of the head. It's important that that hole not be tipped too much either way. Either way, create compression on the cord. If the head is tipped more than 10 degrees and is stuck there, it's permanent impairment. I used to do impairment ratings. I used to do pre-employment physical. If that was more than 10, the direction was don't hire that guy. He's going to get hurt. We need the level head. But that bone inside the head gets stuck to the other bones. So when you do the occipital release, you stabilize the base of the head. On the directions it says use your thumbs. It doesn't matter what you use. You can use thumbs, fingers, you can roll up a towel, you can take a towel, just a regular towel, and lift to hold the base of the head firm. All we're doing is creating a firm foundation. We're going to raise the chin, a lever. We're going to create a lever to create motion inside the head. So when you do the occipital release and you raise your chin, you pull the blue bone away from the orange bone to give the orange bone, the sphenoid, more mobility on both sides. Now that bone looks like a bat. The wings on that sphenoid bone should move every time you breathe. The head expands much like the lungs every time you breathe, and it should. So the head goes like this. So to do the occipital release, you stabilize, you breathe, and you lift the chin about 1 inch, not 3, just 1. And you think the words, I'm getting better and better every day in every way. Now, if they give you a test and say, okay, we have 4 steps. Stabilize, breathe, tip, think. Which is most important?
Think.
A, B, C, D, E is all of the above. People fail in doing that correctly by not breathing deep. Number 1, raising the chin too far. Now I'd like to have you think of the laws of physics and a stone cutter. A really good stone cutter will go tap, 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 maybe hit the stone 1,000 times, and finally he gets a piece off. That's what you're doing when you do the occipital release. You're doing a tiny, tiny bit of therapy to release stress that's built up in your head. If you push too hard or tip too far, you have actually exceeded tissue tolerance. Does that make sense?
What's too hard? How hard is it?
Okay, how hard is too hard?
I thought I was trying to feel him move.
Pardon?
I thought you was trying to feel him move. Can you feel him move?
You can, okay, can you feel them move?
No.
Yes, if they move, you can feel them. You can hear them. This morning, I took mine every day, and this morning I took my little towel right at the bottom, behind my head, and went like this. And I could hear the searches moving. Is that a good thing? Yes, that's a good thing. If they don't move, they're stuck. And what happens in the head is usually one side will get stuck more than the other. And sometimes it correlates with the misalignment down in the pelvis. So I'm going to pause again. From a standpoint of technique as a chiropractor, when I lay a person down, check the sacrum and the head. Always find something in either one or the other or both. If they have any kind of a health problem, it could be stomach, hearing, okay, doesn't matter. Those, the top and the bottom, both need to be mobile, motion, balanced, and then alignment comes last. Now Randy, my boy I told you about, Randy will never be aligned properly. He's had too much stuff done to him. You may never be aligned properly either, but you don't have to be an A patient. You just have to be a B patient. You may be a B minus patient. Randy was an F when he came in. We'll move Randy up to a good B. Okay? Yep.
Sometimes when I first do it in the morning and I go like this, I just hear this little click, 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 click.
Good. That's what you want.
Okay.
Now, the next, in order of priority, sacral slide, acceptable release. Now we go to here, microcranial mobilization. If you come right off the edge of the eyebrows, come straight back about an inch, you'll find a low spot there. That low spot is a special spot on the head. That's the junction of 4 major bones. The most important one is the sphenoid. We're going to do it last. So it's called micro, meaning small, cranial, meaning the head. So it's not a trigger. We're not doing trigger point therapy. We're not doing a massage. We're doing bone mobilization. We want the bones to move. You find that spot. You can use thumb, finger, thin or whatever you want to use. But you're right in the bottom of the valley. Then you stay there. You keep that spot. And I'll tell you the order to do it properly. I'm going to tell you something I haven't told you before, but today it's your lucky day. It's called advanced microcranial mobilization. It has to do with breathing. Remember I told you when you breathe, your right leg first and left leg, you get the same up here. Sometimes when you breathe in, it doesn't move. But when you breathe out, it does. So here's how you do it. You put your thumbs on that spot, and you first take a breath in, and you push toward the eye. You push the bone toward the eye, and breathe in. Okay? Then you breathe out, you push the bone toward the ear.
Toward the ear?
Toward the
This
ear.
way?
Back.
Yeah.
Back to the back of your head.
Oh, yeah. Okay. I usually do this laying down. It's confusing.
Number 3, you push the bone toward the top of the head. And the last one, you push it down on the tip of the sphenoid process, the orange bone.
Now, do you do that just one time through front, backwards, up, down? Is that how many times you do it?
That's a good question. I wondered that too.
Now the advanced therapy. We're going to do it again. Exactly the same thing.
Okay.
But this time, you apply pressure when you breathe out.
Oh.
Oh.
I didn't get that. Oh. Damn it.
So
Well,
go
so
back to the
when
same
you do
spot.
it the first time you
Go back
breathe
to the
in,
same, yes. First
And then
time, you're breathing in.
you're breathing in.
And applying pressure.
This time you're going to breathe in. And when you breathe out, push toward the eye. Breathe in again. When you breathe out, you push toward the ear. Okay?
So
You
breathe
breathe
in.
in, you breathe in again. When you breathe out, you push straight up. Last, breathe in, you push down.
Okay.
Now, that's how you do it.
Okay.
Now, if it's not sore, the need for the motion is less. I checked mine this morning. I check mine almost every day.
Yeah.
I had no problem. But sometimes I do. And sometimes I only have pain in one direction.
So if you only have it on one side, but this one seems pretty good, then
You do both sides, but you
hold it?
pay more attention. You just pay more attention to that side. Okay?
sometimes that feels puffier.
Yeah, and sometimes it's a lot more sore.
Yeah.
Okay.
I'm going to tell you a quick sad story. After I had my heart attack and stroke, I think I've told this before, they gave me Coumadin. They don't want me to have another stroke. So they gave me a high dose of blood thinner. A few days later, I got a nosebleed about 9 o'clock at night. By midnight, we knew we couldn't stop it. We went to the hospital. At the hospital, about 12:30, they said, yeah, you have a bad nosebleed.
Like, duh.
And the doctor's busy, he'll be within a while. We'll put these vice grips on your nose to keep you from bleeding. So they went back and got a pair of vice grips and put it right here on my nose. Tight. Tight. Blood stopped. So I'm sitting there waiting for the doctor at 4:30, 12:30 to 4:30. I'm ready to die because of pain in my head from that. The doctor came out and took the biceps off and the blood started running. He said, oh, yeah, you got a bad nosebleed. We'll stop it with a balloon. So I took the balloon up in there and did like a blood pressure cuff and swelled up inside my nasal cavity. And now I couldn't breathe, but the blood stopped. And I had a tube sticking out of my nose. And he said, okay, we're going to leave that there for about 3 days. I thought, my life had ended. Like, I'm done. The pain was excruciating. So we went home. I couldn't breathe. 2 nights, I couldn't breathe except in my mouth. The pain was very bad. So I called up the nose doctor. He said, can I see you? I'm really suffering from this thing in my head. And so went into her. She took the balloon out. Blood started running. She said, we need to cauterize. Now I know what that is. So she got this little welding tool, tiny welding tool, and I sat there and she burned in my nose. Well, I still couldn't breathe, but the blood stopped. That's the start. That's the beginning of the story. Because of what they did on the inside of my head, my cranial bones were torqued and jammed for 1, 2, 3, 4, about 5 years. It took me about that long to get the motion back into my head. My nose would start bleeding often for no reason, but I could stop it. I finally got my head straightened out. Mostly. And now it doesn't happen anymore. I have no headaches and I can breathe fine, but it took that long to develop motion, balance, alignment, and the time for the tissue to heal.
So did you get off blood thinners?
I'm still on a teeny bit because they're just barely for lowering the risk of stroke.
Right.
So what do you say about the aspirin, the 80 milligrams of aspirin a day?
The latest research on aspirin is if you haven't had a heart attack or stroke and you're over 65, don't start. There's more damage to the gut. If you have had a heart attack or stroke, it lowers the risk a tiny bit. I don't take aspirin. It's recommended, I don't take it.
Yeah.
Okay, now one last thing, it's not on your paper.
That's the one where you push the ball.
there's two more things we're gonna talk about. To help get the scapula back, you stand in the doorway, let your body lean forward, and you stretch the back. Medium, high, and low. Change the hands, do it often. We want to get, everybody needs to have the shoulder back. Chest up, pubis down, rear end up. The last thing I want to tell you about is for the nose, for the sinus. For me, it helped a lot. That's where you put your thumbs right here at the top of the nose. God designed this special spot for your thumb. You can get a hold of that bone.
That hurts.
Grab a hold of the back of your head with your fingers, and you do this. You pull up and out. Now you can do that exercise on the T-zone. You can do it while you're walking. You can do it when you're sitting, when you're laying down. It's called the nasal spread. Okay? Nasal spread. Are you moving bones? Yes, you are moving bones. Do you think breathing matters? Does breathing matter?
Yes.
Yes. The deeper you breathe, you get more motion or less in the head.
More.
What if you just mouth breathe? I know all of you have friends or family members who are mouth breathers. If the mouth breathers, their head is stuck. Their head is not moving properly. I saw a lady earlier this morning who's complained of a jaw problem. If you have a jaw problem, it's nearly always secondary to a cranial misalignment. So the head is distorted. Think of a swing set in the park made of pipes. Somebody, the lawnmower guy, runs into it with a tractor and bends it. Now it's skewed. If the head is skewed, guess what happens to the swing, the jaw, the TMJ? It doesn't swing straight. A lot of dentists will do all kinds of weird things to try to line the teeth, the mouth, the TMJ on a crooked head. It doesn't work.
Can a dentist cause a crooked head?
Oh yeah, yeah. Dentists can do like my people did with my nose. They get up on, they grab hold of a tooth, and they, if you've been there and done that, you know, lots of times they pull pretty hard. You can distort the head, or they push real hard when they try to put something back in. Yes, you can.
Just being in the chair for that length of time puts you out of alignment.
I saw a lady yesterday who lives in Rexburg who she was going to a natural dentist and had all of the fillings taken out. She laid in the chair with a roller on the back for 10 hours.
Oh, wow.
She was in major pain. She had lots of new injuries, but she had bruises on her face. She had bruises on the back, but her mouth is clean.
Oh, wow.
She even stopped swearing.
That would make me start.
I have a question for you about the mobile, all the stuff we just did on the head.
Yes.
Can you do it on children?
Yes.
How young can you start doing it on children?
How long?
Young.
How young?
Day one. Day one. I've treated babies straight out of the womb, straight from the hospital on the way home. It's very common that the head gets distorted when they're coming through that little hole, and they get pulled out, or twisted. And the good news about infants is you can use light, very light pressure. They move quite a bit, and they usually stay better than an adult because it's fresh. It's brand new.
So where you can't ask an infant to breathe for you, how do you work with the breath?
They cry.
Sure, you do have a lot of babies cry in your office.
Yes, I've said many times that I have no friends under 2. And sometimes the mom will give me the baby, and I'll briefly check the head, and I'll say to the mom, "You go out and wait in the waiting room and shut the door," because the baby's going to cry. Sometimes they fight, but they fight hard. And sometimes I don't do much on the first. Sometimes I try to make friends with the little kids, but sometimes you just need. It's like a bad teenager. Sometimes you just need to be whipped.
The teenagers do, exactly.
Thank you.
That's a good question.
My granddaughter, when she was a baby, she started getting ear infection.
Yeah.
And when she got adjusted, they were going to put tubes in her ears.
Yeah.
When she got adjusted, they were gone.
That's very common. That's very common.
Thank you.
The good thing about ears, by divine design, this will surprise you. They heal better if they burst with a ragged edge. I'm talking about the tympanic membrane. Then if they have a hole poked in them and tubes put in, a hole more difficult to heal than a rough edge. So unless the baby is in excruciating pain and you can't get it to drain, I recommend putting off as long as you can having tubes because they don't heal as well.
So if it drains, does that mean that tympanic membrane broke?
It can.
Is that what drains? I mean, doesn't it have, where's it gonna drain from if it doesn't?
Infection.
It doesn't rupture,
Infection.
if you have a
Yeah.
ruptured eardrum.
It can drain down to the mouth as well as out to the ear.
Back to those.
Sometimes the reason they get the problem is because, like me, they have a distorted head. If you didn't line up the head, the ears drain out. Like you're talking about. Okay, next week, again, the whole class will be on T-zones. My intent is to make your T-zones more valuable to use by learning how to use them more efficiently. If your T-zone now is not in a close proximity to where you travel in your home, move it. Bedroom, kitchen, hallway, convenient location. You want it convenient. And if you have friends who you think might benefit from one, invite. Oh, another commercial. Are we still recording? Yeah. Starting in October, I'm going to add back 2 classes. So now we have a class Tuesday afternoon. We're going to add another class Thursday afternoon, 4 o'clock. We have a
What
class
time? 4 o'clock?
Tuesday, Thursday, 4 o'clock. Now we have a class Wednesday, 10. The new class will be Monday, 10. 2 morning, 2 afternoon.
Okay.
Starting in October. I will have a new schedule. It'll be on the newsletter, and I will have these made up for you. I have not yet decided what topics. I will decide within that next couple of weeks. If any of you have any topics that you would like to have me recover or new topics, unless you give me one that's really weird, let me know, okay? I'm open. And I try to modify them so you don't get bored. And if you can't come to class, you can always watch them on YouTube. Thank you for coming.
You did very well.